Everybody good to go? Well, good morning, everyone, and welcome back for our weekly COVID update. Just before I turn it over to Dr. Morrison, I just wanted to begin with a couple of comments. First of all, that to state the obvious, the situation in Canada and the region is changing and is worrisome, to say the least. Just a few short weeks ago, I sat here with great optimism about things coming back to a little bit more normal, including regional travel. Much has changed since that announcement. We've seen the number of cases increase across the country. We've seen variants of concern penetrate our Canadian borders and in some cases take over as the dominant strain in communities across our country. We've seen more people get also moderate to severe symptoms, resulting in an increase in hospitalizations and ICU admissions. And sadly and unfortunately, we've seen a sharp increase in COVID-19 deaths across the country as well. So as I say, the landscape is very different today than it was 4 weeks ago. And it's what we have learned through 13 plus months of COVID is that the importance to pause and reflect on things that are taking place, to look at the science and data as it is presented to us each and every day from the Public Health Office, and to make sure we are doing things in the interests of safety and health for all Islanders. So by all accounts, I'm very happy that we have been spared so far from what is a third wave of this pandemic. But there is regional evidence in Atlantic Canada that is becoming more and more concerning with each and every day. A formal decision on the Atlantic bubble has not been made. We will meet hopefully later today via teleconference with Atlantic premiers. But I did want to be upfront and open with Islanders, as we have been from the beginning, and state that things aren't going our way. The situation is difficult, and I would say that the Atlantic bubble opening on April 19th would be precarious right now. But as I say, that'll be a decision that the Atlantic premiers will make together later today, and a formal announcement will be coming. But all signs are pointing to the fact that we will need to delay that. Look, I know this isn't the news that everyone wants to hear today. I know that there are families who are missing their loved ones in the region and are eager to get the bubble open. I am eager to get the bubble open. We've always been eager to do so when it is safe to do so. We have situations that Dr. Morrison and others have talked about in the past about those who share custody arrangements in our Atlantic provinces and the difficulties that are attached to that. When there's an isolation requirement. We also know there's some health issues that Islanders need to seek a health treatment in other provinces, and that brings with it some challenges. And these are difficult. We've been trying to do our best to work through these, but we know it has an impact, and my heart goes out to those who are impacted by this. But the reality is that we need to remain vigilant. We can't let our guard down. When I hear of areas in our country talking about the need to set up field hospitals, about ICUs overflowing with COVID positive patients, and that more restrictive public health measures and quarantines and curfews are in place, that is information we need to take extremely seriously here, and we have from the beginning. I also know that many Islanders perhaps have come to appreciate the level of comfort and normalcy we've had here in PEI. But that is really pushing against the norm when you look at things that are happening in other parts of this country. So while we enjoy a fairly consistent way of life here right now, that is not something that others in this country are enjoying. And we need to be mindful of that and to be ever careful. So as we have from the beginning, we will take the expert advice from Dr. Morrison and her staff in CPHO. Our decisions will be made using evidence and science and research and data. We haven't strayed from that, and we aren't going to right now. Dr. Morse and I have talked quite a bit over the last couple of days, and I told her on numerous occasions that we haven't gotten many of these wrong yet, and that's because we've had a consistent approach based on science and research. So when the advice coming from the Public Health Office and PEI and beyond is that we should look to pause some of these decisions, I take that information seriously and will act accordingly. So with that, I will turn it over to Dr. Morrison first, and then Marion Dowling following.
Good morning. Thank you, Premier. We do have very much to be grateful for here in Prince Edward Island as we look forward with realism yet hope in the weeks ahead. Today, I'll touch on the COVID-19 situation in PEI and Canada, the vaccine rollout, of course, the Atlantic bubble, and some updates to guidance documents. There are no new cases of COVID-19 to report in PEI today. We currently have 6 active cases and 165 cases since the pandemic began. Canada has recorded 1,071,000 cases and over 23,300 deaths since the pandemic began. In the last 24 hours, there have been 8,541 new cases reported in the country. And over the last week, there has been a 32% increase in the number of new cases reported in Canada. COVID-19 is accelerating rapidly across the country. The daily case counts of new cases is fast approaching the numbers we saw at the peak of the second wave. In addition, there's a concerning rise in the proportion of cases that are associated with the more contagious variants of concern. There have been almost 36,000 cases of COVID-19 associated with variants of concern in Canada, with the majority, 96%, being the B.1.1.7, first identified in the United Kingdom. We are learning that variants of concern are more transmissible and are causing more severe illness. This third wave of COVID-19 is targeting younger adults, with disease pressure shifting away from seniors. Infection rates in Canada continue to be highest among those aged 20 to 39. Across Canada, hospitalizations are up 7%, and intensive care admissions increased 23% this week. In particular, hospitalizations increased for adults under the age of 60, and the greatest number of hospitalizations were among those aged 40 to 59. The numbers highlight that serious illness can occur even in younger age groups, and the evidence is demonstrating the variants are associated with more serious illness and increased risk of death. As a country, we are at a serious juncture with COVID-19. The rising number of variant cases, escalating infection rates in some areas of Canada, increasing severity trends and health systems under significant strain, all suggest we must maintain a high degree of caution until more people are vaccinated. The COVID-19 vaccine program is the most complex vaccine rollout in our history and certainly across the country. The planning and scheduling of clinics is contingent on vaccine supply. Some of the vaccine has to be stored at low temperature, and 2 doses of vaccine are required at prescribed intervals. We are working to immunize as many island residents as possible, as quickly and safely as possible. We are continuing our slow and steady march to immunize all PEI residents against COVID-19. There will be vaccine for everyone who wants to be immunized. This week, island residents aged 55 to 59 can book appointments, and beginning on Thursday, frontline workers aged 40 to 59 who interact with the public or who cannot work virtually can schedule appointments, along with those 18 to 39 with underlying medical conditions, as well as their household members. Frontline workers who cannot work virtually and who are at increased risk include teachers, school staff, including bus drivers, early childhood educators, grocery store and retail staff, public transit drivers, and food and manufacturing and processing workers, to name a few. When it is your turn to be immunized, please book an appointment and get your first of the 2 doses of vaccine. As of Saturday, 35,093 doses of vaccine were administered, including 8,764 second doses. 19.7% of adults over the age of 16 in PEI have received at least one dose of vaccine, and 6.6% of island residents have received 2 doses of vaccine. Most of the vaccine administered in PEI is the Pfizer and Moderna products, the mRNA vaccines. This vaccine arrives in terms of Pfizer on a weekly basis. For most of April and May, we expect to receive 4,680 doses per week and have been advised the weekly shipments will increase in June. We receive shipments of the Moderna vaccine every 2 to 3 weeks, and the timing of these deliveries has been less predictable. Delays in manufacturing or shipping lead to delays in the product arriving in PEI by several days or a week. AstraZeneca is the 3rd vaccine available in PEI. This product is currently available at participating pharmacies across the province for individuals over 55 years of age and older. As of Monday, over 2,000 people have signed up to receive AstraZeneca vaccine at pharmacies. Our ability to get vaccine into the arms of people will become easier as the supply continues to increase. All eligible island residents will be able to get at least their first dose of vaccine before summer. If the supply of vaccine increases, we will begin offering second doses sooner. The 4 health PI clinics are able to administer a large number of doses each day, 6 days a week, and I know Marion will speak to the vaccine clinics as well. I have been asked if people who are here for extended periods of time but do not permanently reside here, if they can be vaccinated. For example, post-secondary students, grandparents providing support to their families, people on work placements, and seasonal residents. These individuals can book an appointment when it is their turn based on the PI vaccine rollout plan, based on age or work setting, for instance. They will be required to wait for the same 12 to 16-week interval as all PI residents. We have encouraged individuals to get their first dose of vaccine prior to arriving in PI. As I've mentioned previously, each person who is immunized benefits all of us. In order to achieve herd protection, we want 80% of the eligible population immunized with 2 doses of vaccine. And we will achieve herd protection 1 person at a time, 1 immunization at a time. I'd like to acknowledge the great work of health PI staff and members of our CPHO team in planning and organizing distribution of the COVID-19 vaccine across the province. For those who are vaccinated at this point, there will be no change in terms of public health measures regarding self-isolation and quarantine. And this is for islanders who travel, family who are visiting, and seasonal residents. But when more island residents are fully vaccinated and we know more about the asymptomatic transmission among vaccinated people, we do anticipate potential changes to quarantine or isolation requirements. When it is safe, hopefully later this summer, any changes to isolation requirements for vaccinated individuals will be for all island residents, family visitors, and seasonal residents. As the Premier has just mentioned, the date and epidemiology in the region and in Canada regarding COVID-19 is concerning. We have increasing cases and hospitalizations, a surge in variants of concern, health systems being overwhelmed, and the reality that we are trying to vaccinate here as many island residents as possible. The regional epidemiologists have been meeting, and I spoke with my Atlantic counterparts last evening, and we discussed the Atlantic bubble. Based on the evidence and concerning epidemiology, this morning I did advise the Premier that I am concerned at the prospect of reopening the Atlantic bubble next week. As I've said before, the decision to reestablish the Atlantic bubble does rest with the Premiers, and they'll be meeting later today. And they will be making the decision. The pandemic has been especially challenging for our loved ones living in long-term and community care facilities. We've seen the devastating impacts of COVID-19 on seniors living in long-term care and their families in other jurisdictions. To date in PEI, we've been fortunate to not have had the COVID-19 outbreaks in congregate living settings. When vaccine became available in PEI, we allocated the first doses to residents and staff in long-term and community care facilities to protect them from severe illness and hospitalization. As a result of the excellent vaccine uptake by residents in long-term and community care, a decision was made recently to further relax visitation guidelines while supporting increased mobility of staff between facilities and increasing the opportunity of residents to attend community church services. In order to benefit from these measures, a vaccine rate of 85% among residents is required. It is important that long-term care and community care facilities submit a weekly report of the vaccination status of their staff and residents to the Chief Public Health Office. To date, several facilities have yet to report their vaccination coverage rates. Operators are responsible for monitoring the vaccine status of residents and staff and to ensure that steps are taken to ensure the target rate of 85% is achieved. A number of our guidance documents are being updated, and when finalized, the information is posted on the provincial website. The fitness facilities guidance and swimming pool guidance have been updated to permit the opening of saunas. The campground guidance has been updated to permit tent camping and clarify mask and record-keeping requirements. There is new guidance for meetings, conventions, festivals, and events to assist organizers and operators in managing multiple cohorts and planning for events with overnight stays. The golf industry guidance is being updated to ease some of the restrictions. For example, returning to normal tee time distribution processes and the return of benches and garbage cans and club cleaners. I find it amazing we're talking about golf guidance again. It was one of the earlier guidance documents we did a year ago. Many families have lost loved ones during the pandemic. COVID-19 has interfered with our usual traditions of mourning and supporting families during their time of loss. The pandemic has interrupted this grieving process for families and friends. And for the past number of months, funeral services in PEI have been limited to one cohort of 50 people. Funerals are emotional events, and it is difficult for people in attendance to maintain a physical distance from others outside their household. As we've seen in other jurisdictions, the risk of transmission of COVID-19 at funerals and receptions is greater than at other public events, and hence we have restricted funerals to a single cohort of 50 people. But effective immediately, funeral services can include up to two cohorts of 50 people, but funeral receptions are not permitted at this time. We know that the basic public health measures work against the variants. Our physical distancing, hand washing, wearing a proper fitting mask in public places, keeping your circle of contacts small, and staying home when not feeling well are effective measures against the original strain of COVID-19, but they are also effective against the variants of concern. National guidance continues to emphasize that people who are vaccinated continue to follow all the public health measures. Islanders should continue to follow the public health measures and be tested for COVID-19, even if they have mild symptoms. The increasing prevalence of variants of concern in Canada underscores the need for individuals to be tested. When I have talked to the team in the office of the CPHO who work tirelessly along with so many others across the province in terms of a COVID response, their most recent thoughts about what is really important right now is, and they named a couple of things recently. They want us to make sure we listen to credible sources of information. And I know we've talked about that before, and it remains true. They want to emphasize to continue to follow the public health measures, physical distancing, washing your hands. And they also acknowledge this pandemic is so challenging. It's frustrating and tiring, and I know we want it to be over. But our border measures have allowed us to have many more liberties than other jurisdictions. So let's continue to respect the rules. Let's be respectful of each other. Let's look out for one another. And there is light at the end of the tunnel, and we need to focus on rolling out the vaccine as efficiently as possible. There will be brighter days ahead, and for now we need to keep our heads down, our guard up, and our sleeves rolled up for our vaccine when it's our turn. In PEI, and I think the Premier mentioned this as well, we've been very fortunate to date. When I see what is happening around the country, the lockdown, curfews, schools moving to online learning, we can be very grateful to be able to carry out most of our activities with some modifications. I'm personally grateful that my children are able to go to school and enjoy sport and recreational activities. I'm glad my mother can go to church, and I'm glad that small groups of friends can get together. As a country, I think there is a rough period ahead. In PEI, we need to stick to our game plan and continue our efforts to limit importation and contain the spread of COVID-19. We have said it many times in the last number of months, we will get through this, and we will get through this together. And as we continue to support and look out for one another, let us continue to be patient and let us continue to be kind. Thank you.
Thank you. Good morning, everyone. Well, we continue to vaccinate as many individuals as possible within the eligible groups, and this week we have close to 6,000 appointments fully booked in our community clinics. Of course, that's in addition to the offering to individuals in the community pharmacies for the AstraZeneca vaccine for those aged 55 and older. This week, we are booking individuals aged 55 to 59 based on birth month, which began yesterday. So as of today, anyone in that age group born through the months of January to August is eligible to book. And beginning tomorrow, April 14th, individuals born in the months of September to December can book. I do have a little update for the groupings that are eligible to book this coming Thursday, April 15th. As Dr. Morrison mentioned, those frontline workers in the community aged 40 to 59 who cannot work virtually, including our teachers, early childhood educators, school staff, including bus drivers, public transit drivers, telecommunications, the food manufacturing and food processing workers are in this age group. Also, for individuals who have certain underlying medical conditions, we are adding those youth aged 16 to 18 as well as those 18 and older that were announced last week. So as of Thursday, people aged 16 and older who have certain underlying medical conditions and their eligible household members are able to book for vaccine appointments. Household members of children and youth under the age of 16 who have those underlying medical conditions are also eligible to book this coming Thursday. As we know, those children aged 15 and younger are not yet able to receive the vaccine. Also, our non-frontline healthcare workers who are needed to maintain our system capacity are able to book. Next week, we'll further open bookings to more individuals. Beginning on Monday, April 19th, people aged 50 to 54 can book their appointment again according to their month of birth, divided into 3 groupings as the group was done this week. So beginning Monday, April 19th, individuals born in the months of January through April who are 50 to 54. Beginning Tuesday, April 20th, individuals born in the months of May through August. And beginning Wednesday, April 21st, individuals born in the months of September to December. On Thursday, April 22nd, vaccine bookings will open as well for those frontline workers, again, who are interacting in person with the public and cannot work virtually, who are aged 18 to 39. A reminder that appointments can be booked directly online using our online booking system at princeedwardisland.ca/getthevaccine. This is the quickest way to book an appointment, and it is very easy to use. Those who can't book online are able to call 1-844-975-3303 to speak to a booking clerk. Please remember you must have a booked appointment to get a vaccine, and also to avoid having too many people at the clinics at one time, please remember to only come to the clinic about 5 minutes in advance of your appointment time. Our clinics are running very smoothly and efficiently, and you will not have a long wait before your appointment begins. A reminder as well to please cancel your appointment in our community clinics if you're not able to attend or have chosen to receive a dose in a community pharmacy. The options to cancel are to call our 1-844 line or cancel with the reminder notifications that you receive 1 week or 1 day in advance of your booked appointment with us. I want to thank everyone for their ongoing patience as we continue to administer the vaccine. I also want to thank our testing staff and laboratory staff who continue to test hundreds of islanders and individuals every day. Thank you as well to those who are being tested if you have any symptoms of COVID-19. Please continue working together with us to limit the risk of COVID-19 by following public health measures, keeping your circle of contacts small, and getting your vaccine. Thank you.
Thank you very much to both of you for that update today. And now, assuming that there are some, we'll open the floor to questions from our friends in the media.
Brittany Spencer, CBC. Hi there. My question is probably for both Dr. Morrison and Premier King. It's about the bubble, and I'm wondering if you do have an approximate date in mind for how long it could be delayed or for when a bubble might be possible. And I'm wondering, is there any way to predict that, given that in the past you've said that we need to learn to live with COVID?
Well, I'll take the first part of that, and perhaps Dr. Morrison can add to it. I think I've said it a couple of times now, and certainly with meetings with Dr. Morrison, it's tough to plant flags in shifting sand, and that's just the reality of what we're at. I think the advice that I'm getting from Dr. Morrison, which is similar to the advice other premiers are getting, is that a pause for 14 to 21 days somewhere in that sphere is required. But we continue to evaluate each day the situation in the region and across the country. We are trying very, very hard to learn to live with COVID, and I think we have learned a great deal of how to live with it. But the great and ever-changing question just becomes is what is the level of risk that we're prepared to live with as we walk new ground. But when it comes into play, the information that we've been seeing for the last couple of weeks here in the country, with more and more people getting sick, more and more people requiring hospitalization or worse, that has to come into account. It always has come into account, and that brings us to where we're at right now. So I want to open the bubble. I've been consistent in that. I don't think it's natural for us to have our borders closed. But at the same time, our first job here is to protect islanders and to keep them safe. And one of the things that has allowed us to really lead the country in that regard has been the efforts we've undertaken at our borders. And that needs to continue. More and more people will get vaccinated, and that will allow us to have a broader, visitation and broader circulation of people in our society. But just with everything going on right now, as I said in my opening, Brittany, Dr. Morrison has provided tremendous advice, and because of that, we've gotten these right. And I have no reason to doubt her on this. It's the way we've done, made our decisions in the past, and it's the way we will continue to do them. But people have said to us, either you're making the right decision or you're making the wrong one, or they assume the broad percentage of Islanders support this or that. And whether or not that's right or wrong, every decision we've made so far has been based on science, research, and data, and that's what this one will be made on till now, or now.
Hi, Brittany. I think I would just agree that we understand, we've said all along, the connections between the maritime provinces in terms of business and families and connections are really important. But at this point, based on what is going on within the region and across the country, I think the data would certainly support a pause on the opening of the bubble for at least 2 to 3 weeks so we can continue to watch what's going to happen.
Okay, thank you so much. And my second question, it might be one that both Dr. Morrison and Premier King want to weigh in on as well. I know we've asked this before, but I was wondering if, considering the situation in the region as it is right now, if the option of a partial bubble, maybe one with Nova Scotia and Newfoundland, is being considered. And in that regard, if there's been any update on the possibility of reopening the ferry service to Nova Scotia early. I know that was something that was being discussed or looked into last week.
We have talked about that really since the closure of the bubble in December. We've tried to find ways to see if we could have some travel with one of the provinces more safely. The challenge is really twofold. Number one is our direct connection to New Brunswick makes it difficult to monitor those coming into the province. It requires us to have a great level of trust. And for the most part, we have a great deal of trust in people, but it becomes a challenge at the border to maintain the consistency of the information that's coming there. So obviously, if we were open to Nova Scotia and there was a Nova Scotia license plate, that becomes a bit of a different situation. But you have to drive for 20 or 25 minutes through New Brunswick to get here from Nova Scotia. It's hard for us to determine if that car has actually gone directly through. And we just feel for the work that would take based on the time period that we're talking about here to do this from an Atlantic region bubble, that it would make the most sense. We have had conversations with Northumberland Ferries about opening early. It's a challenge. It requires Transport Canada approval and funding. There's a couple of components that require negotiation at the federal level, and I don't know where that is at right now, but we've wanted to do this as a region for logistics, for ease and less pressure on our border control staff, and that is where we continue to rest. If this continues on throughout the summer, I think we'll continue to try to find ways, and an open ferry might make that a little bit easier, but it's a logistical challenge for people who are working day and night and have been for 13 months to keep our borders secure, and we don't want to download any more pressure on them than needed. Anything more to add, Dr. Moore?
Okay, thank you so much.
Dave Stewart, The Guardian.
Good afternoon, all. I guess my first question I would think is probably directed at Marion Dowling, but I'll throw it out there for anybody. There has been quite a talk on social media of missed vaccination appointments. I think 30 was the number floated out on social media yesterday. If Marion or someone could just sort of bring us up to speed on how many missed appointments there have been in this attempt to vaccinate Islanders.
Hi, Dave. I don't actually have the exact numbers. I certainly haven't heard that we've had an issue with missed appointments. We have had some challenges with the logistics of the rollout and moving appointments forward sooner for certain groups who had already booked and those types of things, which created some confusion. But people then did come, and they may have come at the wrong time, but had an appointment on the same day at a different time. So we've been trying to communicate those messages clearly so people do know when to come. And also our booking system has a really good notification system which offers people up to 3 reminders before their appointment time and gives them that option of declining their appointment if something does come up. Obviously, we know that there are times when people have other health issues that need to be addressed that come upon them suddenly and does require a missed appointment. But I haven't heard that that's been an issue. I can follow up with you after, though, directly with some numbers if that's helpful.
Okay, thank you.
Welcome.
And a follow-up, I think, to something Dr. Morrison stated in the briefing. If I understood correctly, I was going to ask about those people coming in, but regardless of whether the bubble opens or when it opens, if some people have had both vaccination shots and the need to self-isolate. Dr. Morrison, you looking at, the sort of the first vaccination Islanders are receiving, or would Islanders have to be fully vaccinated towards the fall? I think you said some later in the summer. Just looking for clarification on that.
Hi, Dave. So I think it is the whole issue and the whole area of adjusting public health measures according to people's vaccination status is a discussion happening across the country. It's happening within the region and certainly here provincially as well. And so we are continuing to look at the evidence and emerging evidence around real live effectiveness data around vaccines, 1 dose versus 2 doses. That's maybe different than the trial data that we had last December. We're looking at what do we know and what we don't know about asymptomatic transmission, even amongst those who are vaccinated. And when we start looking at those numbers and our vaccine rates, we do anticipate adjustments in terms of our quarantine and isolation periods over the months ahead. But at this point in time, there are not changes. If you arrive here with 1 dose or 2 dose, you still have to isolate for 2 weeks. But we do anticipate those changes will happen, and we're hopeful they will happen in the months ahead, but we will probably be able to have more details around what we anticipate in the weeks ahead, and I think the Premier is aware of that as well. So, but at that point, it won't be just for one group. It'll be for Islanders who want to travel. It'll be for families who are visiting here. It will be for seasonal residents, and so I think it'll be for everyone, but we do want to make sure that we're in a different position than we are in right now. We'll try to protect as Islanders with vaccine as much as possible. So those are things that we're actively looking at, Dave.
Thank you very much.
Okay. And Dave, the only other thing, just to follow up on Marion's comment, that if there is an appointment that's missed, or someone doesn't show up for an appointment, any additional dose or vaccine at the end of that day, we are using. If someone needs a vaccine for compassionate reasons, for instance, if they have to travel to a different country to see a loved one who's really sick, for instance. We are trying to make sure that each appointment is filled up and that they're called at the last minute, and someone is getting vaccinated who needs to be vaccinated if someone doesn't show up for their appointment.
Thank you very much.
You're welcome.
Sarah Plowman, CTV News.
Hi, guys. I'm just wondering if, regarding the Atlantic bubble, you did kind of answer this already, what would it take for the science to suggest that it is safe to reopen? You said this is based on the science. What kind of data are we looking for in order for it to be good enough?
Hi, Sarah. So the last couple of weeks, we've talked about some of the criteria the epidemiologists are looking at in terms of the Atlantic bubble. So we're looking at criteria such as the number of cases per day and an average over so many days of the week. In the preceding week, we're looking at outbreaks, we're looking at geographical spread, we're looking at the variants of concern, and of course, certainly also I know they're paying attention to what is going on outside the region as well. So the epidemiologists are going to be preparing that kind of information for us on a weekly basis to help us make those decisions based on the information we have.
I guess my follow-up is just, is there a threshold of case numbers that we're seeing in other provinces that you're looking at?
So there's a threshold. It's one of the criteria in terms of the number of cases, but it's also around one of the criteria is around non-epi-linked cases, so cases that aren't linked to travel or to other as close contacts of other cases. So that is one of the criteria they're looking at as well for each of our provinces, and then they are also meeting together to review that information.
Gabrielle Trumont, Radio-Canada.
Good afternoon. Ma question, c'est en français pour la docteure Edda Morrison concernant la bulle atlantique. Docteur Morrison, vous êtes la personne qui conseille justement le premier ministre Dennis King par rapport à la réouverture de la bulle atlantique. Vous avez dit ça en anglais, mais j'aimerais que vous me dites en français, s'il vous plaît. Alors, quel est votre conseil que vous donnez au premier ministre Dennis King à ce sujet de la réouverture de la bulle atlantique, s'il vous plaît?
Bonjour, Gabrielle. Alors, mon conseil c'est basé sur l'information et l'épidémiologie de la région atlantique et vraiment partout au pays. Et on a plus de cas de variants. On a au pays plus de personnes dans l'hôpital. Alors, mon conseil qui est basé sur cette information et l'évidence est de suspendre la boule atlantique ou l'ouverture de la boule atlantique pour 2-3 semaines pour qu'on peut voir qu'est-ce qui arrive dans la région et partout au pays.
OK, tout à fait. Et le premier ministre avait dit qu'il faut qu'on reste positif aussi, mais quand vous regardez ces données épidémiologiques-là, je sais que vous avez dit en anglais, mais j'aimerais que vous me dites aussi en français. Alors, quelles sont les données que vous voulez voir justement pour recommander cette ouverture de la bulle atlantique? Est-ce que vous pouvez préciser quelles sont ces données-là?
Alors, on a des, on s'appelle ça en anglais les triggers ou c'est les criteria qui sont discutés parmi les épidémiologistes dans la région pour regarder le nombre de cas qui sont pas liés aux autres cas, qui sont pas liés au voyage. Si on a des outbreaks et le nombre de cas de variants. C'est aussi le nombre de cas qui arrivent partout au pays, mais c'est des choses comme ça qu'on regarde. Et à ce moment, on a la région et le pays a l'air vraiment pire qu'on a suspendu la boule atlantique le fin novembre, le 1er décembre. Alors, mais c'est les choses comme ça, ils regardent ça chaque semaine et nous présentent l'information et puis après ça, on conseille les premiers ministres.
OK, tout à fait. Merci beaucoup. Bonne journée.
Bonne journée.
Marine Arnaud, La Voix.
Good afternoon to you all. J'ai une question en français pour vous, Dr. Heather Morrison. Je pense que vous l'avez dit en anglais, mais j'aurais voulu que vous le répétiez en français. Pour les personnes qui ont entre 40 et 60 ans avec des problèmes de santé, est-ce que les membres de leur famille peuvent se faire vacciner en même temps? Est-ce que c'est tous les membres de la famille?
Bonjour et merci pour la question. C'est les personnes entre 16 ans et 39 ans parce qu'on a déjà fait les autres qui ont les conditions médicales et puis c'est les membres de leur famille, de leur household qui peut être vaccinés au même temps.
D'accord, merci. Et ma dernière question, je pense que vous l'avez aussi dit en anglais, mais est-ce que les insulaires qui doivent quitter la province, qui doivent quitter l'île pour des raisons essentielles, peuvent se faire vacciner avant, même s'ils ne font pas partie des groupes prioritaires?
C'est une bonne question. Alors, si les insulaires doivent voyager pour les raisons de compassion ou médicales ou même pour les raisons pour travailler essentielles, on fait nos mieux de les identifier pour voir si on peut les vacciner avant qu'ils partent. On ne peut pas faire tout le temps, mais on essaie quand on a besoin. On sait s'ils voyagent ailleurs au pays, il peut aussi, les insulaires peuvent être vaccinés dans les autres provinces aussi. Alors, si ils doivent voyager, ils vont rester là pendant quelques mois, ils peuvent aussi être vaccinés là. Même qu'on fait avec les personnes qui vont rester ici pendant quelques mois, qui ne sont pas les insulaires. Alors, mais on essaie de faire notre mieux, mais on a beaucoup de personnes qui sont déjà dans les cliniques pour être vaccinées.
OK, merci beaucoup.
De rien, merci.
Louise Martin, CBC.
Hi there. Good afternoon. Dr. Morrison, I just want to pick up on what you said about vaccines that, potentially left over at the end of the day, say for missed or no shows at appointments. Does PEI have a wait list that potentially could be opened up to anyone? I know some other provinces have done that. If there's leftover at a clinic or in the hospital at the end of the day, there's a list of people and they call them to say if you can get here within X amount of time, you could get your vaccine.
I'll let Louise, I'll let Marion start. Yeah.
Hi, Louise. I'll probably take that. So we monitor the vaccine doses very carefully. So we actually only take out what we need on a daily basis, and we do monitor people coming to the clinic. So we don't open that extra vial if we have, if it's Pfizer, for example, if there are less than 5 people or 6 people left to come to the clinic and some don't show up, we don't actually use that extra vial, so we don't make sure we waste no doses at all if possible. We do have a short list of individuals who are waiting for those compassionate reasons or for other medical reasons that they may be in need of more urgent vaccine appointment based on their health condition, so that we have those individuals that we can call. So we don't have a need to open it up for others. It's been working quite well to have that list. We try and accommodate all those urgent needs, but really we're trying to make sure doses are all used and available in those clinics. So we don't have a list. I think I understand what you're asking about in other jurisdictions where we've opened it up to say at the end of the day, post on social media, show up at our clinic and there's 5 doses left. Our staff are monitoring it really, really closely as the clinic day progresses to ensure that we don't open that additional vial. It could be used the next morning instead if that was necessary, or we have a number of people who are waiting for those extraordinary circumstances that they're in needing a dose sooner.
I mean, one example would be, Louise, someone who has just found out that they're going to start chemotherapy in a couple of weeks, and it's really important to get them vaccinated a couple of weeks before that chemotherapy for certain kinds of cancers might start. So that person might be on the list to be called in for a vaccine.
I see. So are people able to sign up for that, or is that more you're finding out about these people that may need an urgent vaccine?
The example I just gave, we are working with the oncology clinic to identify those, a system for identifying those people.
So much for clarifying that. Sorry for my confusion on it. And I just want to quickly ask about Islanders between 18 and 29 who had their first doses of AstraZeneca. Is there any new on an update on what their second dose will be? Is there any update on mixing brands of vaccines, for instance?
Well, Louise, I'm also waiting for some of that information. It is NACI is meeting again this week. And they'll be looking at the information about whether or not we would be offering a second dose of AstraZeneca to those 1,800 people who had 18 to 29-year-olds who had AstraZeneca as their first dose. So that information is being looked at nationally, and we'll be taking that advice. There are trials ongoing we call them the mix and match studies. And I think some of the earlier trials will be available out of the UK. We have not had those reviewed here in this country in detail yet, but we'll be certainly looking at those as well.
All right, thank you to both.
You're
All three of you,
welcome.
actually. Have a good day.
Thanks.
To Meatby, The Guardian.
Hi, good afternoon, everyone. Change gears a little bit. Question to Dr. Morrison. There was a media statement from the Chief Public Health Office back in February about warning Islanders about the presence of cannabis products mixed with fentanyl, methamphetamine, and W18. I'm just wondering what evidence was provided to you by the chief coroner supporting the assertion that there were cannabis products mixed with those substances that, were circulating in PEI at the time.
Hi, Stu. So the information that we were provided by the coroner at that time is raised with us so that we can alert, from a public health point of view, alert anyone else who we certainly want to try to prevent any fentanyl overdoses. And so that information is important to get out. So that was information that we received a call to the office from the coroner at that time advising us that that was the information they had, and those public health alerts go out. So we've done that in previous circumstances as well, and I think it's certainly part of a public health notification based on the information we have at the time to do so. And we'd always want to err on the side of trying to protect people with the information based on the information we were given by the coroner on that day.
Okay. I guess I'm I was sort of wondering if there were actual kind of like lab tests of cannabis substances that were contained fentanyl or anything like that. I mean, people have sort of called the claim of cannabis laced with fentanyl sort of a disinformation. BCCDC has sort of referred to it that way. Ontario Harm Reduction Network has sort of said that there's no confirmed cases of cannabis products laced with fentanyl. So I'm just wondering if you're concerned that, a claim like this might erode trust, I guess, from individuals who may use drugs in Prince Edward Island who do listen to the Chief Public Health Office.
Well, I mean, I think we know that we've had more cases of overdoses related to fentanyl in the last year than we did before. We've talked about that before, Stu, and we know that most of the overdoses involve mixed toxicology, meaning that there a variety of substances are being used, and the coroner and with the police services do testing of drugs at the time, and that was the information that was provided to us. So, I mean, I think that's, and I know you would want to do the same thing, wanting to make sure the information is out there to, basically what we're saying is be careful if you're using any drugs, if there was a test for fentanyl in what they were testing for. So I mean, I think it's, we know that there have been overdoses related to fentanyl across this country. We know we've had overdoses of fentanyl in this province, and it is an important thing that we need to continue to deal with. And I don't think there's anything that we would do differently, and I know the coroner would, if you wait for an official autopsy to come back, it couldn't be weeks, months, and that is not going to help protect people. So when we're given certain information, we should get that out.
So was there an actual lab-confirmed case of fentanyl in cannabis at the time?
So the Chief Public Health Office doesn't do the lab tests on the street. That would be with the police and the coroner. And they provide us with the information, Stu.
Okay, thank you.
Julien Le Cachard, Radio-Canada.
Hi, good afternoon to everybody now. Question in French for you, Dr. Morrison. Dr. Morrison, vous l'avez dit, c'est compliqué pour des familles qui sont éloignées, par exemple des gens qui vivent à l'île du Prince-Édouard et qui ne peuvent pas voir leurs proches au Nouveau-Brunswick ou en Nouvelle-Écosse. Est-ce que avec cette pause de la bulle et avec bien les cas qui remontent, est-ce que vous pourriez créer un espèce de permis ou une exception pour les résidents de l'île du Prince-Édouard qui auraient reçu 1 ou 2 doses du vaccin afin d'aller voir leurs proches ou de la famille dans les autres provinces de l'Atlantique et de ne pas s'isoler à leur retour?
Bonjour. À ce moment, on ne fait pas les exceptions pour les personnes qui voyagent n'importe où. Pour même s'ils ont eu 1 ou 2 doses de vaccin. C'est important que notre population, un bon nombre de personnes, vraiment 80% au moins 1 dose et un grand nombre qui ont 2 doses, vraiment, on attend l'information pour voir vraiment si on a beaucoup de transmission, même entre les personnes qui ont un vaccin. Mais à un moment donné, j'anticipe que ça va changer, mais pas encore.
Deuxième question pour vous. Maybe I'm going to switch in English because I would like maybe an answer from you, Premier. In Nova Scotia, they just said like they are going to put like more restriction at their border with New Brunswick. We don't know yet how long it's gonna stay like this there. But do you think if Nova Scotia closed the border with New Brunswick and the ferry is back, do you think like it would be easier for you to say like open maybe a small bubble just with Nova Scotia? I know you already said it's going to be tough, but if the border between Nova Scotia and New Brunswick is closed, do you think like it would be easier and it would be a possibility for us?
I don't know. I know I've spoken this morning to Premier Rankin just about travel in general. We have talked in the past and did briefly today to wonder how we would explore such an endeavor. I'm not so certain as to the border at New Brunswick and Nova Scotia, if it is as restrictive perhaps as ours. I don't know if that's the proper word, but I know in the past that has been almost more of an information type picket and border crossing as opposed to ours being more sealed and secured. But I need to talk to Premier Rankin just to determine what their next few weeks looks like at that border crossing. But just the logistics of it are just challenging. It's much easier and better and more efficient for all of us if we can do this as a region. But I think I don't want to close my mind to anything in this time of COVID. I think we've learned how important it is to remain flexible and open-minded on some of these things. But Dr. Morris and I have talked about it for several months now, and it's just, it's difficult to do one without the others, and our preference remains an Atlantic bubble when it's safe to do so, and as soon as it's safe to do so. And but as I say, if this grinds on longer because of the situation with cases across the region and the country, we'll try to reevaluate then. But right now, our goal would be travel within an Atlantic bubble, including all 4 provinces. Well, thank you both very much for today's update, and thanks to our friends in the media for being there as well. And to all Islanders, I would say have a good remainder of the week and stay safe.